All right, welcome. If you're just joining this call, I want to specially thank you for requesting to be part of what we are doing right now. My name is Kingsley Okoro, and I'm your host for tonight. I am the lead consultant with KEDI Health Center. We are we're representing a company that came all the way from China, from Hong Kong in China to Africa over 15 years ago. And this company has been responsible for helping people find solution or cure to a lot of diseases, including many of the diseases that have been termed medically incurable. That's why you need to count yourself lucky for being on this call today, because you're about to discover one of the most important secrets that no doctor will mention to you. Okay, I titled this webinar, The Secret Cure to Pelvic Inflammatory Disease that your doctor will never tell you. And that's because a lot of doctors do not even know this exists. A lot of doctors are not aware of what I'm telling you right now. And that is why most of the people that we've encountered, and that's actually the reason we decided to host this, because of the high number of cases that we've encountered, women coming to us with cases of infertility, and they've been struggling with it for years, going from place to place, spending money, swallowing pills, going through difficult treatment procedures without any solution. And a lot of them are having this issue of pelvic inflammatory disease, which is also known as PID. They are having this issue and they are not aware of how to solve it. And a lot of families are struggling with childlessness basically because of this. Okay, so most of these women actually thought they treated this problem a few years back. Most of them had it when they were still single, and they treated it, and then today they got married and they can't have a child, without knowing that the treatment they thought they did not actually handle the case properly. A lot of damages has been done in their reproductive system because of PID, and that is why they cannot have babies. Okay, so but thankfully when they encounter us, we go back to the root cause of the problem, which is PID, and we start to show them things that this problem has caused in their body and what they need to do to get rid of it completely. Thankfully, most of them have started the treatment, started seeing the result. A lot of them have had their testimonies already. Okay, so what you're about to discover, no, I don't believe there's a lot of doctors that knows about this. That's why in KEDI Healthcare we've been responsible for helping thousands of couples who were once barren. Today they're having their babies. And this PID is not just for people who are looking for a child. No, we also encounter a lot of young women who have been struggling with infections. And most of the times they try as much as possible to treat this infection without any solution. They try to take medications and it feels like the problem is going, and then after a while it comes back. And due to some of the mistakes that women make, a minor infection later graduates into PID. And once it becomes pelvic inflammatory disease, it becomes a more terrible situation, capable of causing long-term damage. So I'm going to handle this in details today so as to help you, not just to tell you, I didn't just call you here to tell you this is what to use in treating PID and this is how much it will cost. No, my motive here is not just to bring you here and sell to you. My motive is to bring you here today and enlighten you, educate you, because it is one thing to get cure for a disease, it's another thing to make sure that disease doesn't come again. And I need you to understand how this works and why it usually occurs, so that you can prevent it from occurring. So whether you're here today because of yourself or on behalf of a loved one, I need you to pay attention. You might want to get writing materials that you can use to jot down important points from what I'm going to be sharing with you today, so that you will know how to handle this disease, whether it is pelvic inflammatory disease or any vaginal infection at all. I need you to pay attention because I'm going to share deep things with you that will help you prevent it or cure it if it's already there. Okay, so let's get started. There are 3 things I'll be doing today. The number 1 thing I'll be doing today is to unravel the problem. I'm going to share helpful information, help you to understand what this pelvic inflammatory disease is all about, to understand what really puts you at risk of having pelvic inflammatory disease, to help you understand the certain symptoms that you should look out for, so that if you are probably having some of these symptoms, so that you really know that you need to do something about it. And then after unraveling the problem, what next I'm going to be doing is to debunk the lies that have been fed you over the years. Yes, there are lies that you've been believing when it comes to pelvic inflammatory disease that I need to help debunk today. And I'm going to help you understand what is the real truth, because it is when you know the truth that you can be free indeed. All right. And then after that, finally, I'm going to review the solution to pelvic inflammatory disease, so that you know that this disease actually has a permanent cure. When I mean permanent cure, what I mean is when you solve it, it doesn't come back again, especially if you follow the teachings I will teach you and know how to prevent it. All right. So most people think this infection is a recurring infection, but that's because the treatment that you've been using is not putting it to a permanent rest. What you're doing is you're trying to suppress the symptoms. After a while, the symptoms comes back. Why? Because the disease itself is still there. So I'm going to go into these 3 things and then we'll call it a day. All right. So let's get started with the first one, which is unraveling the problem. So what are the things you need to know about pelvic inflammatory disease? So let me start this way by showing you this diagram. This diagram is a representation of a woman's pelvic region. So another word for pelvic region in a woman is a reproductive organs of a woman. The pelvic region harbors the reproductive organs of a woman. So you can see here, you see the ovary, you see the cervix, you see the uterus, you see the fallopian tubes, and you see the vagina. So all of these things are anchored by the pelvis. When we talk about pelvic inflammatory disease, we are talking about any disease that causes harm to a woman's reproductive organs. That's what we call pelvic inflammatory disease. Any infection that climbs up to the woman's reproductive organ and cause whether temporary or permanent damage, that's what we call pelvic inflammatory disease. It's usually caused by infections. All right, so I'm going to show you how that works. Like you're seeing here now, this is a woman's ovary. This is an inflamed ovary. When an infection has affected the ovary and it becomes inflamed, it begins to damage it, and that is why a woman can no longer release a healthy ovary or a healthy egg that can be fertilized. This is one of the things that causes infertility. You can see an inflamed fallopian tube. So when the fallopian tube has been infected and is inflamed, it becomes a problem, because normally a healthy fallopian tube is supposed to be a passageway for an ovary to go and meet a sperm for fertilization. Do you understand? So this is one of the things. It can affect any part. So usually when an infection comes into the vagina and you don't take care of it early enough, a little bit of mistake, a little bit of activity that a women engage in can push this infection and make it begin to travel. And it begins to travel down to the cervix, to the uterus. It can affect this area, it can affect the ovary, it can affect the fallopian tube. So whichever area of the pelvic region that the infection affects, that's what we call pelvic inflammatory disease. I hope you understand. So that's why this infection is critical, because it's one of the major causes of infertility in women. Most women have infection and they joke with it. You just go and buy antibiotics and take, and then the symptoms stops showing up. You think you're okay. You go about with your normal life, and then after a while the symptoms are back. You go back and buy antibiotics and take. You're just joking with yourself. Even if you're still young and you're not at a marriage age, One day, what you're handling carelessly may have been incubating in your pelvic region, and it will cause pelvic inflammatory disease, which will be a very terrible condition. Alright, so who is at risk of becoming diseased in this PID? Who is at risk of having PID? What exactly increases your risk? Any sexually transmitted infection like gonorrhea, chlamydia, or any STI at all can cause pelvic inflammatory disease. So if you're engaging in any activities, unprotected sex, or any other activities that can put you at risk of having any sexually transmitted infection, you are inviting pelvic inflammatory disease. Yes, because it usually begins from there, but it doesn't only come from STI. It can come from non-sexually transmitted infection like normal bacteria. And I'm going to show you how normal bacteria can become PID in your body system. Alright, so that's what usually causes PID. So there are other factors that can increase your risk of having PID. One of them is having sex under the age of 25. Yes, because some research has proved that most of the people who have PID are under the age of 25. So most times when a woman begins to have sex early enough, it can increase your risk of having PID. That's one of the risk factors, okay? Another risk factor is having multiple sex partners or having a partner who has multiple sex partners. So when you have multiple sex partners, you're increasing your risk of having infection. So when you have a partner who has multiple sex partners as well, you're also increasing your risk of having infection because your partner could go and get infected, bring it back and give to you. And then most of the times, these infections don't show symptoms early enough. And because they don't show symptoms early enough, you may not even know that you have it. And as time goes on, it goes up to your pelvic region and becomes PID. Once it becomes pelvic inflammatory disease, that's where you have a problem. Okay? Another thing is having unprotected sex. That's why we always talk about protecting yourself, especially if you're having sex with someone you're not married to. Always use protections. Okay? Another one is recently having an IUD inserted in your body. There's a device that women insert in their body to prevent pregnancy. It's called intrauterine device. So most of the time, this device increases your risk of having PID. Why? If you already have an infection in you, even if it's a bacterial infection, even if it's not an STI, this process of inserting an IUD can push those infections up to your pelvic region and it becomes PID. That's how it happens, okay? So that's why it is recommended always get treated of infection before trying to insert an IUD. Otherwise, avoid it completely. Now, the next thing, which is one of the major cause of PID, is douching. It's one of the major cause because a lot of women are still ignorant to the fact that douching is not good. What do I mean by douching? The process of either using water or any liquid. There are liquids that are manufactured for the purpose of douching, and these companies are selling it and making money even when they know that douching is very harmful to a woman's body. Using those liquid or even water to wash the inside of your vagina. Most people do it in an attempt to keep the vagina clean. No, you are not supposed to help the vagina to get clean. Okay, because naturally you are created with natural floras that cleans up the vagina on itself. So if you're douching because you want to help to clean your vagina clean, you are risking having PID. You're putting yourself at risk of having pelvic inflammatory disease because the process of douching can push any bacteria. Even if the bacteria is at the tip of the vagina, it can push the bacteria inside, and the bacteria will go up to your pelvic region and cause pelvic inflammatory disease. So douching is not recommended. No reasonable doctor can recommend douching for women. There are women who douch because they want to use it as a process of deciding the sex of their baby. There are some research that says that when you douch before you have sex, it can affect the sex of your baby. It can help you decide the sex of your baby. I'm not going into that right now, but I'm telling you, no matter the reason, douching is not recommended. It's not advisable. because it is the major cause of pelvic inflammatory disease. Another reason most women doubt is after having sex and they want to prevent themselves from getting pregnant, they try to use their hand to wash up the sperm from inside of their vagina. The truth is that thing you're doing cannot even prevent a pregnancy. If pregnancy wants to occur, even with that activity, it can still occur. But while you're doing that, you're putting yourself at risk. Okay? So do not doubt. I hope you're learning something. Another risk factor of PID is family history. If you have a family history of a pelvic inflammatory disease, probably someone in your family line has had PID before, there's a high chance that you could also have pelvic inflammatory disease. Okay, so now what are those symptoms that you should look out for, so that when you experience them, you will go and check yourself to make sure that you get treated? There are symptoms that once you're seeing them, it should be a pointer to you for you to know what to do immediately. All right, so the first symptom I'll talk about is having pain in your lower abdomen. When you're having pain in your lower abdomen and it is mostly regular, you need to go and get tested, because that's one of the major symptoms of pelvic inflammatory disease. Pain in the lower abdomen, pain in the upper abdomen as well can be a symptom of pelvic inflammatory disease, although it can also be a symptom of other issues like ulcer. But when you have such pain, go and get tested. That's why we call them symptoms, because they are pointers. It doesn't mean you have it, but once you experience these symptoms, go and get tested to be sure whether you have pelvic inflammatory disease or not. Okay. Another symptom is fever. Now, there are fevers that you will have and you know it could be malaria, it could be typhoid. Okay. But when you're having a high fever that comes regular, high fever that even when you take drugs, it doesn't go, it may be that fever is as a result of pelvic inflammatory disease. Okay, so it's important that you go and get yourself tested. Now, if you are having painful sex, when you have sex with your partner, you feel serious pain, and this is making sex unpleasant for you, that's a symptom of PID. It's a symptom of infections. Okay, so it could be PID, it could be any other infection. So you need to go and get yourself tested to know what to do. Painful sex is a bad sign, a sign that something is wrong with you. Okay, so if you're also having painful urination, it could either be urinary tract infection or it could also be pelvic inflammatory disease. Okay, so that's one of the symptoms. Another symptom is irregular bleeding, like your menstrual flow is not regular. You need to go and get yourself tested. A lot of people think that having menstrual cramps is normal. In fact, I've had a young girl argue with me that menstrual cramp is normal. It is not a sign of a problem, but I wish she knows better. Okay, menstrual cramp is not normal. It's usually a sign of a problem. So go and get yourself tested to know why you're having that problem, whether menstrual cramps or irregular menstruation. Go and get yourself tested. Okay, now if you're having vaginal discharge that is smelling bad, smelling terrible, that has this foul odor, it's a symptom of infection. Okay, so you need to go and test to know what kind of infection you're having. Most likely it could be pelvic inflammatory disease. And then another symptom is frequent tiredness. It's also a symptom of pelvic inflammatory disease. So those symptoms I mentioned are mild symptoms, but there are severe symptoms that most women have. And these severe symptoms, you can't take them for granted. Even if you're taking these other ones for granted, these ones can never be taken for granted, because it means that the problem has gone beyond normal. I hope you know that PID can be life-threatening. Yes, there's a level pelvic inflammatory disease can get to. It becomes life-threatening. And it's always important when you're having this severe symptom that you need to go and get yourself taken care of. The number one symptom I want to talk about under this severe symptom is sharp pain in your abdomen. Now, if you're having this sharp pain that makes you very uncomfortable, that's a severe symptom. Another one is vomiting. There are some women that when they're having this pelvic inflammatory disease, they begin to vomit. Some people even faint as a result of pelvic inflammatory disease. And then I mentioned fever previously. Now this, I'm talking about a high fever. Okay. Now most of the time people don't know that pelvic inflammatory disease can even go beyond your pelvic region and enter your bloodstream. Yes, and that is usually one of the reasons why they have severe symptoms. So if you're having severe symptoms, you need to get medical attention immediately. It's an urgent matter. Why? Because there's a possibility the infection has spread to your bloodstream. And once the infection spreads to your bloodstream, it's a life-threatening condition. It kills. So PID is not something you should joke with. It's not something you should handle madly. It's not something you should just use antibiotics carelessly for. Because when you're doing that, you're probably empowering the disease, because pelvic inflammatory disease can kill. So take it very seriously, okay? So now, how do you prevent pelvic inflammatory disease? Now, it's simple. Looking at the risk factors I mentioned earlier, you can already know that these are the things you need to avoid to prevent it. Practice safe sex. Practice safe sex. Stop being careless with your life. Okay? Unprotected sex is very, very dangerous. There was a time it became common knowledge when HIV newly became a thing. But today, people are no longer afraid of HIV because of they now know that even HIV patients can live a normal life if you are placed on drugs. But what people don't know is that HIV is not the only reason you should practice safe sex. It is not the only reason. Okay? A lot of other reasons, infections, and one of those terrible infections can be pelvic inflammatory disease. So if you're practicing careless sex, unprotected sex, you're making yourself vulnerable to pelvic inflammatory disease. Alright? Another thing is to get tested for sexually transmitted infections regularly. At least twice a year, get yourself tested. Okay? I hope you know that a woman's body can incubate infections. You could have infections and not have symptoms. So it's not always true that you will know whether you have infection or not through symptoms. Most women who come to us, when we run a test on them, they are shocked when we tell them they have infections. Why? Because they've had these infections and it's not showing any symptom, and they think they are okay. And those are the people who are at high risk of having PID. Why? Because you could make a little mistake with yourself. Something like douching can make those infections to climb up and become PID. And for most women, even when they don't doubt, once infection has stayed in your body for a while, it keeps traveling gradually. At a point, it gets up to your pelvic region. It becomes pelvic inflammatory disease. That's the problem most people are having. So get yourself tested as often as possible so that you know how to protect yourself. Alright? So another thing is practice monogamy. Okay? Monogamy is not just a religious thing. It's not just a religious advice. It's actually for your own good, for your own health. Don't be sleeping around. And also make sure that you're not having a partner who sleeps around. It's very important. A lot of women have died carelessly because they have men in their life who sleeps from one place to another. And when they go and carry infections, they bring it home and give to the innocent woman. And the woman doesn't know, thinking, okay, I'm just sleeping with my husband, I can't have infection. So I'm telling you, make sure that your partner understands the need for being faithful to each other so that you reduce your risk of having an infection. I hope you understand me. Good. So another reason, I don't need to mention this again, do not doubt. Do not doubt. It's very, very important that you pay attention to this. Do not doubt. There is no good reason for doubting. Forget about what they tell you. Those people marketing doubting liquid or fluids, telling you that it has health benefits. It doesn't have health benefits. Don't doubt. If you think your vagina is not clean or you're discharging something unpleasant, putting hand to wash your vagina is not healthy. Go and treat infections, and those bad vaginal discharge would stop. But naturally, your body is meant to clean itself. Your vagina is meant to clean itself using the healthy flora that it discharges. And you also have some healthy bacteria that God put into your vagina to protect it from infection. But when you doubt, what you're doing is you're killing those healthy bacteria and you're replacing them with bad bacteria. Now, those bad bacteria is what increases the heat, the pH level of your vagina and causes infection. Okay, so always wipe yourself from front to back when you use the toilet. It's important. Wiping from back to front can push those feces to your vagina and it becomes a problem. So teach your girl child as well, even at a young age, to wipe from front to back when they use the toilet. Or better still, wash yourself with water. Okay? Because these little mistakes can cause long-term damage in a woman's health. Okay? And do not abuse alcohol. And there is another prevention that I didn't mention. There's something I didn't mention, I didn't put in my slide, and that is sanitary pads. Thankfully, a lot of women have begun to embrace this truth because they started experiencing it. Most of the sanitary pads women use increases your risk of having vaginal infections and also your risk of having pelvic inflammatory disease. Most of the cheap sanitary pads you buy in the market, some of them have nylon in them. Most of them have bad, harmful chemicals in them. I used to ask most of my students, I say, tell me the truth. When you take a look back at history, the days of our mothers, when sanitary pad was not a thing, were you hearing of, or do you think they had problem with some of these gynecological health challenges that women have today? Ovarian cysts, endometriosis, PID, gonorrhea, chlamydia, trichomoniasis, most of these diseases that women struggle with today. Most of those women in those olden days didn't have them. Why? There was no sanitary pad. They were using their normal napkin and wrapper to help themselves. Now, science came in and taught us that those practices are unhealthy, and they now brought synthetic sanitary pads. What they did not tell us is that synthetic sanitary pads has chemicals in them that causes bacteria's infection. It has chemicals in them that kills the healthy bacteria in your vagina and opens you up for a lot of infections for you to struggle with. Another thing those sanitary pads does with their chemicals is that it changes the pH level of your vagina and it also disrupts your endocrine system. What I mean by endocrine system is the part of your body that controls your hormone. All your hormones function in the body is controlled by your endocrine system. Okay, so when a woman is having hormonal imbalance, it means that the endocrine system has been disrupted. So that's why a lot of infertility cases today is also caused by hormonal imbalances. Why? Because most of the women are using sanitary pads that is disrupting their endocrine system. So I needed to include it in my slide, but I didn't. But thankfully, I remember to mention it now. Be careful with the sanitary pad you're using. And I'm going to introduce you to a better sanitary pad, which is not synthetic, has no chemicals, has no nylon, does not incubate bacteria. Instead, it has negative ion that helps to eliminate the bad bacteria and boost the strength of the good bacteria in your vagina. And it also regulates your endocrine system properly so that you will not have hormonal imbalances. I'm going to introduce it to you because it's part of what I'll be using to treat your PID if you're ready to get treated, alright? I'll give you a medication and I'll also give you this sanitary pad and tell you how to use it to achieve the result, alright? So those are the prevention. Finally, do not abuse alcohol because taking alcohol may not directly cause PID, but taking alcohol probably in public, in party, nightclub or anything can increase your chances of behaving abnormally or taking certain risks that can lead to pelvic inflammatory diseases. So now, what is that thing that makes PID so terrible? What are the complications of having pelvic inflammatory disease and not finding a better cure? I'm not just saying not finding a cure, I'm saying not finding a better cure because A lot of women thought they treated pelvic inflammatory disease. I've encountered a lot of them. Unfortunately, they didn't know, and I'm talking about after 3, 4, 5 years, they realized that PID was still in their system. The only thing they succeeded in doing with the treatment they did was bringing down the symptoms so that it doesn't manifest. But the problem is, it was still there and it was still causing damages. That's the problem. So if you don't treat it properly, you could have complications. And one of these complications is infertility. I mentioned at the beginning that pelvic inflammatory disease is one of the reasons a lot of women are struggling with infertility. Yes, the inability to conceive a child. That's one of the problems of pelvic inflammatory. How does it happen? As an infection, PID can cause damages to your reproductive organs, like you saw in the diagram I showed you earlier. You can see it damages the ovary. And once it damages the ovary, just forget about it. The only chance of having a baby can come from one side. If only one side of your ovary is damaged, then your only chance is now depending on the remaining side, which is still healthy. But if both of them becomes damaged, you don't have a possibility of getting a child again because fertilization begins from the ovary. This is where your body releases a healthy egg into the fallopian tube. And then a sperm coming from here is supposed to travel through the fallopian tube to meet the egg there. And then after fertilizing the egg will now have to travel down to the uterus where it now anchors and starts to develop into a baby. But when PID occurs, what it happens is it damages the ovary, making it impossible for a healthy egg to be released for fertilization. Or it damages the fallopian tube. Once it causes a problem in the fallopian tube, there can be what we call a scar in the fallopian tube. So when there's a scar, it will cause a blockage in the fallopian tube. When an egg is released to the fallopian tube, that blockage that has been caused by the scarring will hold it there. And when a sperm comes and tries to go and fertilize the egg, the blockage can prevent the sperm from meeting the egg. And fertilization will be impossible. And after a while, the sperm will fall and die. The egg will wash away. That's why a lot of women, even when they are ovulating normally, cannot conceive. Why? Because something is preventing the sperm from meeting with the egg to fertilize it. So that's one of the ways PID prevents fertility. Why? Because it either damages the ovary or it causes an obstruction, making it impossible for sperm to meet and fertilize the egg. It could also damage any other area, the uterus, the cervix. It can damage any area and make it impossible for fertilization to happen. And even when fertilization occurs, it leads to miscarriage. Why? Because of these damages. I hope you're following, you're paying attention to what I'm sharing with you, because it's very important that you understand it. So that's one of the complications of untreated pelvic inflammatory disease. So if you're having childlessness, you're ovulating normal, and you are finding it difficult to conceive, or you conceive and it goes away through miscarriage, there's a high chance that what you're having is pelvic inflammatory disease. It probably has caused a blockage in your fallopian tube or a damage in any of your pelvic region, leading to miscarriages. Or maybe you don't even ovulate. It could be because your ovary has been damaged by pelvic inflammatory disease. I really hope it's not, okay? So that's the number one. The second complication I want to talk about, which is very critical because it's claiming the lives of women, is called ectopic pregnancy. What is ectopic pregnancy? Ectopic pregnancy is pregnancy that occurs outside of the womb. Pregnancy that occurs outside of the uterus. Like I was explaining here, if there's a blockage here and the egg cannot pass, there's a chance that when the sperm comes, it might find a way through the blockage because sperms are not big. Pay attention. Sperms are not big. So one of it could find a way through the blockage if the fallopian tube is not completely blocked. And when it passes and fertilizes the egg, what happens? Naturally, the fertilized egg is supposed to now travel down here to go and meet, or rather to go and anchor in the womb. But because of that blockage, you know that an egg is bigger than sperm. So just because a sperm was able to pass through and meet an egg doesn't mean the egg can pass. So this fertilized egg will no longer have the capacity to pass through the blockage to go and anchor in the womb. What happens? That fertilization or that fertilized egg it's now trapped in the fallopian tube, and it begins to develop right there in the fallopian tube. That's what we call ectopic pregnancy. And you can already imagine how dangerous this is, because the fallopian tube is not meant to anchor or to harbor pregnancy. So what happens when pregnancy begins to develop here? It can cause a rupture, which can lead to sudden death of a woman. In most of the cases, a doctor will recommend surgery to cut this place and remove that pregnancy that is happening here and try to stitch it back. But when that happens, most of the time, this place, through surgery, it can be damaged completely, and you will not be left with one. So what if fertilization doesn't happen here? What if this one becomes affected again? You see, now you have a big problem. Okay, so ectopic pregnancy should be your number one, your major worry. I think I have a better image that shows it. Right, good. This is what we call ectopic pregnancy in real life. This scan was able to capture real life ectopic pregnancy. See how it happens? The egg moved up to the fallopian tube and can no longer pass. It got fertilized here, and the pregnancy is developing here. As time goes on, if surgery is not conducted to remove this, it can burst this place, and this could kill the woman. So ectopic pregnancy is a life-threatening condition that every woman needs to do their best to avoid. Okay, so do your best to avoid any chances of having ectopic pregnancy. If you're having any symptom of infection, even if it is not yet pelvic inflammatory disease, get it treated properly. Don't manage it with antibiotics. Don't manage it. Get it properly treated. Don't manage it with herbal concoctions that people mix in bottles and give you. You're causing more harm for yourself, and you're empowering that disease more. Alright? So if you're having this kind of challenge, or you know somebody who is having this kind of challenge, or you even want to prevent it, stay with me to the end of this video, because I'm going to share with you the only known cure, the secret cure to this problem that most doctors don't know even exists. Alright? So another complication is what we call chronic pelvic pain, which is common. Okay? This is a pain in the lower abdomen that is caused by a scarring of the fallopian tube or any other part of your pelvic region. So once this infection has caused a scarring, this pelvic pain will become paramount. Alright? So a lot of women are feeling this pelvic pain, not just because of menstrual cramp, but because of PID. So you need to take care of it. Alright? Now here are other things I need you to know. The infection can also spread to other parts of your body. If it spread to your blood, it can become life-threatening. Okay? If it spread to your blood, it can become life-threatening. So I need you to see how terrible this can be. So it's not just about the ectopic pregnancy. If this pelvic inflammatory disease now enters your bloodstream, it can become life-threatening. The next thing I need you to know is your chances of getting pregnant are lower if you have had PID more than once. Yes, a lot of women have had PID more than once, and what that means is that they've had PID in the past, they went to the hospital, it got treated, and then after some months or some years, it came up again. Like I explained earlier, what happened is it is either the PID was not properly treated before, or it was treated, but due to their careless lifestyle, it came back again. So what this is saying is, if you have had PID more than once, you're reducing your chances of getting pregnant. Why? Because PID is causing damages to your reproductive organs. And most of these damages, doctors don't have treatment that can repair them. I hope you know that. It doesn't. So take care of yourself. The next thing I need you to know is, even having just a little scar tissue can keep you from getting pregnant without fertility treatment. Just like I've explained to you, your pelvic region is very delicate. A little scarring can prevent pregnancy from taking place. And then lastly, ectopic pregnancies are 6 times more common in women who have had PID compared with women who have not had PID. So ectopic pregnancy is more common. So PID is not the only thing that causes it. Okay, fibroid can also cause ectopic pregnancy. Why? Because fibroid can block the fallopian tube. If you had multiple fibroid that spreads, it could block the fallopian tube and cause ectopic pregnancy. But that one is even scarce, like it's not common. But PID, as you can see, ectopic pregnancy is more than 6 times, it has more than 6 times chances of happening to women who have had PID than women who have not had PID. So I believe that you have understood every basic thing I need you to know. You can take your time, read up about PID again to have more knowledge about pelvic inflammatory disease, but I believe I've been able to do justice to it, to share with you the most important things that you are supposed to know about pelvic inflammatory disease and why you shouldn't joke with it. Now, the second thing we need to do in this video is to debunk some lies. Okay, these are lies that I believe that you probably have been fed. All right, so I need to tell you these 3 lies that you must never believe when it comes to pelvic inflammatory disease. The number 1 lie is that PID can be treated by repeatedly taking antibiotics for a very long time. This is the number 1 lie, because we have met a lot of people. A lot of women has come to us after they have been taking antibiotics prescribed by doctors. Like I mentioned earlier, antibiotics might reduce the symptom, but it doesn't mean that the PID has been cured. The disease on its own is still there, waiting for another time to recoup its strength to manifest again. But even while it is not manifesting, as long as it's present there, it is causing damages to your system. So you can't be romancing pelvic inflammatory disease with antibiotics. If you have other smaller infections, antibiotics might help you cure them if you take the right one, because I hope you know that antibiotics, it's possible that the one you're taking doesn't match the infection that you're having. And when you even make a mistake of taking an antibiotics that doesn't match the infection you're having, what you're doing is you're empowering that infection. And as a result of that, that infection will become more powerful than any antibiotic that you take. Even if you take the right one later, it won't work. So most people believe that by repeatedly taking antibiotics, they can treat their PID. I'm going to tell you the dangers of taking antibiotics for a long time. I'm going to tell you the dangers. A lot of people don't know how dangerous it is. But let's talk about the lie number 2. The second lie I need you to know is what most doctors say. If drugs are no longer working, or if the disease has caused any damage to your pelvic organ, what you need to do is to come for surgery so that they can cut off the damaged area. That's what most doctors will recommend. So they use surgery to remove any part of your pelvic region that is damaged. But surgery doesn't cure the problem. Surgery has not taken away the PID. That's just the truth. Surgery doesn't take away the PID. What surgery does is, if there's a pelvic region that has been damaged, what it can do, for example, they can cut it off and stitch back. But the problem is that surgery on its own is high risk. It has its own risk. It is not supposed to be your number 1 option. Okay? I consider surgery a last resort if every other option has failed. That's when surgery can be a last resort, especially if it is necessary for saving the person's life. because almost all surgery have complications and have side effects. Now, the third lie I want to debunk is, if surgery is too risky or you're unable to get pregnant even after treatment, your only remaining hope is an assisted reproductive technology. For example, IVF. Now, before now, we believed this to be true. I mean, we've seen a lot of women who went through IVF, surrogacy, or any other ART to get pregnant or to get a baby. It's possible to have children using these methods, but not everybody can afford it. It is high risk and not everybody can afford it. It's risky in the sense that most of the time it fails. A lot of people who have done IVF to get a baby will tell you that they didn't get their baby on their first attempt, not even their second attempt, not even their third attempt. There are people who try up to 5, 6, 7 times. And all these trials cost millions. Each of them cost millions. So you can see that it is not possible for people who don't have that kind of money. Alright? So, but thankfully we already know that there is a better way to solve this problem, and I'm going to get into that, okay? But now, first of all, did you know that most medical treatments for pelvic inflammatory disease do not produce permanent cure? I hope you already know that by now. Most pelvic inflammatory disease medications does not produce permanent cure. It only helps to manage the symptom, and I've been able to explain that so far in this video. And then finally, I said I was going to talk about this. Synthetic drugs and surgeries have dangerous side effects to your body. That's just the truth. The more you're taking these drugs, thinking that you're working on your PID or your infection, it has its side effects. Number one side effect is that it's damaging your liver, it's damaging your kidney. A lot of people are having kidney failure today because of drugs they've been taking over the years. Another problem is that it's affecting your blood vessels. Most people will have stroke. Why? Because of the high toxins that have entered their bloodstream as a result of antibiotics. And most of the times, you're taking antibiotics to treat infection, and the antibiotics is working against your body and is empowering the infection. So the more you take, the more powerful the infection becomes. After a while, the infection will no longer be afraid of any drug. It becomes what we call odesh. No drugs, they kill them again. So these antibiotics, they have their side effects. So I recommend, when you have infections and you take antibiotics once or twice and it doesn't cure it permanently, seek alternative method. Alright? Because the truth is that you can be completely cured from infection. Any infection at all, including PID. You can be completely free from pelvic inflammatory disease. And you can still get pregnant and have babies naturally without complications. All you need is what? The right treatment. The right treatment. And unfortunately, the right treatment most times are not found in hospitals. Yes, because the doctor can only give you what he was trained to give you. And what was he trained to give you? Synthetic treatment or Western treatment, or what we commonly call orthodox treatment. Any disease that orthodox treatment cannot cure is beyond your doctor's capacity. And funny enough, once the orthodox treatment cannot handle it, what doctors do is they now tell you it is medically incurable. By medically incurable, they are telling you it is no longer curable, making you believe that as long as they can't cure it, it cannot be cured. But it's not always the truth. We have seen cases that doctors cannot cure that ended up being cured outside of Western medicine. And one of those cases is pelvic inflammatory disease. Yes, because the treatment procedure that we use in KEDI healthcare defiles medical treatment. It defiles medical treatment. And what is that treatment procedure? That's the number 3 thing we're going to be doing today, which is giving you the solution to the problem. I believe that at this point in time, you're ready to get rid of pelvic inflammatory disease or any infection at all. Now, you want to get cured. There is a better way, and that way can be found in KEDI healthcare industries. Now, why do I believe that this is the better way? Number one is that the solution I'm giving you is 100% natural medicine. And it's not something that came today. It's from 5,000 years ago. It's natural. It has no side effect. When I say it's natural, it means that there are no chemicals inside. You know that chemicals is what orthodox medicine has given you. And I'm not trying to rubbish orthodox medicine. They are doing their best. It has its place. But the truth is, consuming chemicals repeatedly is what is causing more harm to our system than good. And it's unfortunate that a lot of people no longer take anything natural. Everything they consume, starting from the food they eat, to the drugs they take, to the air they breathe, the environment, everything has been chemicalized. Even fruits that you buy out there was cultivated with chemical fertilizers. Most of the fruits, like watermelon, they use chemicals to inject them to make them look ripe. So we eat a lot of chemicals in our system. And that's why our training, our treatments in my company always begins with detoxifying your body system, eliminating those toxins that has come as a result of the chemicals that you've been consuming over the years. That's what we do. We eliminate those toxins so that your body can accept the natural treatment that we're giving you. Because natural treatment doesn't work well when your body is laden with chemicals or toxins. Okay? So the number one reason it is a better option for you is that it is 100% chemical, all the way back from 5,000 years old. That's what we call traditional Chinese medicine, TCM. Traditional Chinese medicine is a medication that has been used by the Chinese for 5,000 years now. That have been used by the Chinese for 5,000 years now. Most of us don't know how long 5,000 years ago was. It's a very long time. Now we're talking about the beginning of the world. So up till today, it is still the most effective form of medicine in the world. Even though Western medicine are not trying to recognize it, doctors don't recognize it, they don't want to talk about it. Why? Because they see it as a competition. But the truth is that what we need is for people to get well. What we need is for people to get solution. We don't want people to keep having recurring diseases. So traditional Chinese medicine, as old as it is, remains the most effective form of medication. And so far, KEDI Healthcare is the only company that is bringing real traditional Chinese medicine in its natural form. It's 100% natural form. No chemical preservative added to it, nothing. So when you're taking those medications, what you're taking is 100% natural. You can go and run a test on it anywhere and you'll confirm it. A lot of doctors have run a test on it. NAFDAC has run a test on it and they have confirmed it. It's 100% natural, no side effects. Okay. The second reason I believe that it is the best option for you is when you're taking our medication, the medication is not attacking your symptoms like other treatment does. What it's doing is eliminating the problem from the root cause. So it is looking for the root cause of the problem and it is eliminating the problem from there. This is how we achieve permanent cure. Now, let me give you an example. You want to chop down a tree. What is the best way to remove this tree from here completely and preventing it from growing there? Is it to cut the tree from the half? No. What most drugs you take do is that it is attacking the surface of the problem. Meanwhile, the problem is still rooted down there. So, but when you take our medication, it goes down to the root to uproot the problem from your body system. And that's why we say our medication will give you permanent cure. The number 3 reason why I believe it is the best option for you is that it improves fertility and increases your chances of having your baby with no complication. Yes. So while you're taking our medication to treat it, and I'm going to show you how to achieve that. So after treating your infections, you will boost your fertility so that pregnancy can take place easily as possible. All right. And then finally, like I mentioned, we dispel toxins from your body and other infections. Our medications are always multifunctional. So even if you're taking our medications because of pelvic inflammatory disease, be rest assured that it is also eliminating other little infection that is in your system, so that there will be no chance of it coming back again. Is that not wonderful? That is what we will do for you, and that's what I want to show you how to achieve right now. All right, so let's go down into how to cure pelvic inflammatory disease following 3 simple stages. Yes, because our medications or our treatment usually work in stages, all right, depending on what we are treating. So if you can follow these 3 stages I want to show you right now, you will not only cure pelvic inflammatory disease, you will ensure it doesn't come back again. And it will also ensure that you can get pregnant whenever you want. Even if you want to get pregnant immediately after your treatment, you will get pregnant. All right. So the first stage, we call it the detoxification. This is the process of eliminating toxins, waste products, free radicals, dead cells, and all of those things that are working against your body. We eliminate them from your body system, especially starting from your digestive system. Why do we do this? Because we want to prepare your body to receive our treatments and work with our medication easily. Our detoxification will also reduce the acidity level of your body, because when your body is highly acidic, you're prone to be sick easily. Also, when your body is highly acidic, medications will struggle to work, including our medications. This is why detoxification stage is important. The truth is that this detoxification stage, these medications for detoxification, are not the main medications for treating pelvic inflammatory disease. That will be in the second stage. But we put this first stage here because without the first stage, the main treatment might struggle to work if your body is full of toxins and waste products. And from my experience, almost everybody who hasn't taken our medication before has a lot of toxins in their body. If you've been eating, of course, you know that we don't eat natural products, we don't eat balanced diet anymore. So most of the food we eat deposit toxins and waste products in our system. The water you drink that is not alkaline is making your body acidic and toxic. The environment you live in, the air you're breathing, can be responsible for toxins in your body system. And what again, the drinks you take can be responsible for toxins in your body system. So a lot of things are responsible for toxins in your blood, in your body system. And also, and most especially, the drugs you've been taking. If you've been taking synthetic drugs all your life, be rest assured that there's a high level of toxins in your body. Even if you've been taking herbal concoctions, I call them herbal concoctions because that's what they are. Most of the people selling herbal medicines, they pluck herbs, grind them together, or squeeze them, give you to drink, or they boil them, put alcohol, or whichever way they are doing it. Most of those things it has not undergone clinical testing. So they have not been able to extract the harmful part of those herbs. Every herb that you take, it has its active ingredients and there are harmful part of it. Those harmful part of it are the part of it that your body doesn't need. Those parts that can cause more problem to your body system. So we have encountered a lot of people who come to us and they have damaged liver. Some of them have damaged kidney. And when we ask them, we realize that they have been taking drugs and they have also been taking herbal concoctions. Most people, once drugs is not working, the next thing they take herbal concoction. These people that usually buy, what do you call it, abo, every now and then. I have seen people who take abo every day. So they are regular customers. They believe that they are taking care of themselves. Most of them have a lot of toxins in their body. So when we want to start our treatment, we first of all detoxify your body system so that your body can be clean. And the good news is that by the time you finish detoxification, you will definitely feel a lot better. That will show you that your body system is back to normal and ready to fight the disease that we're about to treat. Okay, so what do we use to detoxify? You can see 4 different medications here. We have the Gastrifort, you have the Constellis, you have the colon cleanser, you have the Chinghao. This Chinghao is both for detoxing and also for malaria. It's the same thing we use in treating malaria. It is our anti-malaria. In fact, it is the most powerful anti-malaria in the world. This is not me speaking. This is the Nobel Lawrence Award Prize has been won because of this medication as the most powerful anti-malaria in the world. Okay, so if you're living in Africa, if you're living in Nigeria or any part of Africa, you have malaria. I don't care if you just finished taking antacids or any other anti-malaria, you have malaria in your bloodstream. You have malaria in your liver. So we give you this Chinghao to eliminate it completely so that you can respond to treatment better. So Gastrifort is important for people who have ulcer. If you're having ulcer, I recommend you use Gastrifort and Chinghao for your detoxification. If you're having constipation or you're having bile, I recommend you use Constellis and Chinghao for your detoxification. If you're not having ulcer and you're not having bile, you can use colon cleanser and Chinghao for your detoxification. But if you have money, you can use all 3 of them. Yes, they all have their health benefits. Each of them have their health benefit. So if you can afford to buy all 3 of them, all 4 of them rather, for your detoxification stage, we will show you how to take them. It's better for you. Okay? But if you don't have enough money to afford all of them, because remember, this is not the main treatment. We're still going to the main treatment. This is just for your detoxification. So if you cannot afford all of them, just choose one of these 3 and add this Chinghao to it. The only one that must be there is Chinghao. So Chinghao can go with either Gastrifort, Constellis, or colon cleanser. I personally prefer colon cleanser. Why? It's very easy to take. It's like Lipton. You put it in your water, you take it, and it cleanses off your system, detoxifies your system. Constellis also detoxify your system. Gastrifort also detoxify your system, but these ones have added benefits, like this one is detoxifying you and is also taking care of ulcer. This one is detoxifying you and is taking care of constipation, is taking care of bile. Okay? And this one also is good for nourishing the skin, because while it's cleaning up your bowels and your system, the effect is showing on your skin. It is nourishing your skin. That's Constellis for you. So if you need any of these added benefits, you can choose any of these ones. Or you can buy colon tea and Constellis together. Or you can buy colon tea and Gastrifort. But if you're having ulcer, don't go for colon cleanser, because colon cleanser can cause severe pain to your ulcer. So we recommend anybody having ulcer should avoid colon cleanser. You can go for Gastrifort and Chinghao together. Okay? So that is it for detoxification. This is the first stage. It is the most important stage before you go to the major treatment. Do not skip this stage. I beg you. Because a lot of you might want to play smart, save money. You say, I don't want this stage. I believe my body is okay. Let me go to the direct treatment. If you pay, some money will collect, but there's a high chance that the direct treatment will be slow. And you have to take more and more of it for your body to respond to it. Why? Because of a lot of toxins that are in your body system. So take my advice, do your detoxing first before you now go to the second stage, which is the main treatment stage for pelvic inflammatory disease. Okay, this is the main treatment for PID. This will eventually get rid of all the infections that led to the PID, and also take care of all the damages that has been caused by PID, especially fallopian tube scarring, those scarring that causes blockage in your fallopian tube. This treatment will remove it, and it will unblock your fallopian tube so that you will no longer be infertile. This stage, you must follow it seriously, and you may need to repeat it. What I mean by that is, depending on how severe your case is, just taking them once may not be enough. You might need to repeat it twice or 3 times for the medication to completely eliminate the problem from your system so that it can give you permanent care. Okay, so what do we have? We have Reishi, we have Gynafarm, and we have 7-layer sanitary pad. I talked about sanitary pad earlier in this video. This is the sanitary pad I was talking about. Okay, it has what we call negative ion that has the capacity to fight infection and also regulate your endocrine system and also help to boost up the healthy bacteria in your vagina so that your vagina can normally and naturally fight off bacteria. So it's a very important sanitary pad. It was not manufactured by KEDI just for sanitary pad purposes. It was manufactured for treatment purpose. So even if you're not having infections, still use this sanitary pad for your menses. Why? Because using it will prevent infections from affecting you. It's very, very important. I recommend every woman to stop using all those cheap sanitary pads you're using and use this sanitary pad that was manufactured for the purpose of helping you to maintain a healthy state of health, especially a healthy gynecological health. That's the purpose of this sanitary pad. And even if you're having healthy flow, it's even the best option for you because it absorbs better, 5 times better than any other sanitary pad you know. So it's the best pad in the market. This is Reishi, our natural antibiotics. Now, this antibiotics is different from the antibiotics you buy in the drugstore. Why? That one is chemical. This is natural, 100% herbal. And it is the most powerful antibiotic in the world. Yes, it's so powerful that it treats any kind of infection. Any kind of infection. There is no infection that can withstand Reishi. Okay? We have used Reishi to tackle even HIV. Yes, I'm not talking of AIDS, I say HIV. We use Reishi together with another medication called golden hypha to tackle HIV, and the viral load dropped to the minimal level. It dropped. The person went for test and they tested HIV negative. That's how powerful this Reishi is. This Gynafarm was manufactured specifically for women. Anything that has to do with infection of your pelvic region, that's what Gynafarm is. So we'll show you how to take them, how to use this medication. Because this sanitary pad is not just used like every other sanitary pad. There are ways to use it to get result, okay? So we're going to show you or guide you properly on how to use this prescription to get the results that you want. This will take care of your pelvic inflammatory disease, no matter how long it has been there. To take care of your pelvic inflammatory disease, to take care of every other infection that causes pelvic inflammatory disease. It will unblock your fallopian tube if you have a blocked fallopian tube, and it will help you to become fertile. Alright, so that's it. We've talked about the first stage, detoxification, and we've talked about the main stage of treatment for PID, which is this one. Now, why do we have a third stage if this is the main treatment for PID? Let's talk about it. The last stage, which is the stage 3, is for the purpose of boosting your fertility. And you can see we have 2 products here that we use to do that. Golden 6 and Vital Prego. They are for boosting fertility, both for helping to balance your hormone, because a lot of people, as a result of infections, they end up having imbalanced hormone. So these medications will help to balance your hormone, will help you ovulate naturally, will help to nourish your fallopian tube, your ovary, and your uterus, so that the process of conception, fertilization, and pregnancy period will be smooth and natural. Okay? It's important that after the problem has been taken away, you need to restore your body system to normal, repair those damaged areas in your hormones and your body and your pelvic region, and also balance your hormones so that your fertility can be boosted. This is the final stage of our treatment when we're handling any problem of infection, especially pelvic inflammatory disease. Okay? So you can get pregnant easily and have children whenever you want without any complication. This product you're seeing here was manufactured for women. This one, both men and women can take because it has other functions. Okay, but this, women alone takes it. Why? It was manufactured to help you before pregnancy, to prepare your body system for pregnancy. During pregnancy, you will keep taking it to help your pregnancy period to be smooth without complications, and to help your baby to become stronger and healthier. And then after pregnancy, it will help you. You keep taking it. It will help to bring back your body to normal faster, so that you don't have a postpartum complications. Do you see how wonderful it is? So these two medications combined together is what we use in our final stage of treatment to ensure that you will not have complications or difficulties when you want to have babies. Okay? Now, remember this. If you're sexually active, now this is important. Pay attention to this. If you're sexually active, that means if you have a partner you're having sex with, and you have PID and you want to treat it or any infection, there is need that your partner should also get treated alongside you. Why? In order to prevent this disease from coming back after treatment, so that you don't spend money treating your PID or your infections only to realize that this infection came back again. Why? Because your partner that you've been having sex with, there's a high chance that he has that infection if you have been having sex with this person. So if you have infection, there's a high chance that this person has contracted this infection. So when you're treating yourself, this person is still keeping his own. After treatment, you go and have sex with him. He will return the infection back to you. So that's why when we're treating women of infection, we usually ask, are you sexually active? If yes, we'll give you something to treat your partner as well. And we even advise most of the time to abstain from sexual intercourse while you're doing your treatment, until you and your partner have both been treated completely. So that's one key point I need you to remember, okay? So it's important so that you don't waste your money, treat yourself only to go and get back the infection again. And then you have to start all over again. There's no wisdom in that. All right? So here's the reason you must act fast today. The reason you must take action immediately to get yourself treated if you have pelvic inflammatory disease. Number one is, if it is not treated early enough, infections can get into your bloodstream and it can become life-threatening. I have mentioned it before. If it is not treated early enough, it can get into your bloodstream and it can kill. Number two is, if you suspect that you have a blocked fallopian tube, you need to stop trying to get pregnant as soon as possible or immediately. Why? Because trying to get pregnant can result to ectopic pregnancy. I have told you what ectopic pregnancy is and how dangerous it is. Alright, where is that my image? I've shown you how dangerous ectopic pregnancy is. Trying to get pregnant when you have a blocked tube can result to this, and this can be life-threatening. The only way to remove this is through surgery. If you try to use our medication to remove it, you're going to take it to very, very well before it can be able to remove this. So if you have ectopic pregnancy, we can remove it, but you will take the medication very well. Okay? So if you notice or suspect that you have blocked fallopian tube, stop trying to get pregnant. Get it treated fast. Okay? Now, the third thing I need you to know, the reason you need to act fast is, using surgery to treat PID can cause permanent damage to your reproductive organs. That's just the truth. Some of these damages, not even KEDI product can reverse it. So that's why we don't recommend surgery. In our business, in our office, we don't recommend surgery. Your doctor might recommend surgery. Why? Because that's the only solution he has. But we advise, please, use our natural medicine to treat this, and do it fast. Don't allow it to deteriorate to the point where surgery becomes your last resort. Be wise with your health, okay? There's another fourth reason you need to act fast. When you treat PID with synthetic antibiotics, the infection may return later, as drugs hardly cure the diseases completely. And according to the Center for Disease Control and Prevention, about 1 in 8 women with a history of PID will have difficulty getting pregnant. Do you understand why? Because the drugs they give you to treat PID doesn't cure it completely, and their treatment procedure does not repair the damages that PID has caused. That's why even if you treat PID using their drugs, you will have difficulty getting pregnant. And they say about 1 in every 8 women with a history of PID will have difficulty getting pregnant. Now, this is why our final stage of treatment is very important. Why? Because after treating the PID and repairing the damaged organs, we need to restore your hormones back. We need to restore your body system back. We need to nourish your body system so that your fertility can be boosted and you can get pregnant easily. Do you understand what I'm talking about now? So that is why I believe that what we have is the best solution to pelvic inflammatory disease. So what do I need you to do now? Here's a simple thing you need to do now. If somebody shared this video with you, and where you're watching this video, there's no link or no button for you to click. All you need to do is contact that KEDI Consultant. That person is most probably in my team. Okay, so contact that person and get started with your treatment. On the other hand, if there's a button you're seeing under this video right now or a link, I just need you to tap on that button and follow it wherever it leads you, and let's get started with your treatment. I assure you, this will be the very last time you have to worry yourself about pelvic inflammatory disease, especially if you follow any of all those my instructions, those preventive measures that I have shared with you, adding it to our treatment. This will be the last time you will ever have to worry about pelvic inflammatory disease. So thank you very much for being with me in this training. As you can see, I didn't mention prices of any of our products here. Why did I not do that? Because first of all, I don't know which you'll be going for, and secondly, I don't know when you're going to be watching this video. I don't know if the prices would have increased by then, so I don't want to mention any price and then cause confusion. So when you contact the KEDI Consultant who gave you this video, or you click the button, you are going to discover how much it will cost you to do your own treatment and get your result. But no matter how much it costs, it will not be up to the cost of doing surgery. I assure you of that. It will not be up to the cost of doing surgery that will not even eliminate the problem completely. Because surgery can remove a damaged part of your system. But you just know that once a part of your system is removed, it has been removed completely. It will not grow back. But surgery does not cure the problem. Okay? So with our procedure, we'll cure the problem, cure the cause of the problem, and ensure that you get pregnant easily whenever you want. So is this not the best solution for you? I believe you already know the answer. So thank you very much for watching this video to this point. I believe that you'll be sharing your testimony with me any moment from now on how what you did after watching this video resulted to you becoming free and living what I call a disease-free lifestyle. So see you on the other side.